Good evening. My name is Allie Brammer. This is Tom Robertson, Shane Brammer, and Katie Robinson. How do you respond in an emergency, whether it's major or small? Tonight, let's dive into what a seizure looks like and how to respond to it. So what exactly is a seizure? A seizure is a burst of electrical activity in the brain. This can result in unconsciousness, blank staring, and involuntary muscle movement, such as twitching. So what exactly causes a seizure? There's a very wide range of what actually causes a seizure. Some of the examples or conditions could be epilepsy, head injuries, brain tumors, infections, strokes, or even genetic factors. Now, seizures don't just happen on their own. Sometimes they need a little trigger to occur. So triggers can include stress, flashing lights, hormonal changes, sleep deprivation, and in children, sometimes fevers. So how do you respond? According to CDC, the steps are to follow. Remain calm, not only yourself but others. Now, how do you remain calm in a situation that's so critical? So some of the things that you can do is deep breaths and just focusing on the patient. You need to stay with the patient. The only time you would really need to leave is if you need to go call 911. You want to remove harmful objects out of their field of area. So that way, if they twitch or jerk, they don't hit their head off of a coffee table or something hard that can injure them further than just the seizure in general. And then you want to check for a medical bracelet or a medical ID card. So that way you can see if they have any condition that makes them prone to seizures or any medication that you need to give them after 5 minutes, or who to call if this were to happen. Next, you want to place them on their side in a recovery position. So they're on their side with their head and mouth facing the ground. So that way, if they were to spit up or foam at the mouth, which is very common when somebody is seizing, it doesn't block their airway and it can just go onto the ground and doesn't go back down and end up suffocating them. According to CDC, you also need to track time, so that way if their seizure goes to a point where it is past 5 minutes or more, you need to call 911 and give them the rescue medication to hopefully pull them out of it. And then once everything's over, make sure you sit with them and explain what happened. Do this slowly so that way they don't get confused. And then ask them if you can call any family or friends or anybody to get them home. And then make sure you stay with them until they are safe with family, friends, or in a hospital. So how do you give somebody the rescue medication? So I have 3 different types of rescue medication here. We have the anal, the nasal, and a tablet. So the anal is like a shot. So you stick this up the rectum of usually children. It's mostly always children that you use this type of rescue medication with. So you stick this up the rectum and just inject it like it's a shot. And then the nasal is like a nasal spray for allergies. Depending on their weight, you either have 1 or have 2. This should be with their medical ID card. And you just put it in their nostrils like an allergy spray and inject and spray it into their nasal cavity, which will go into the respiratory system, stopping the seizure hopefully. And then lastly we have the tablet, which you just put in their mouth, hopefully in the back, and that way it will dissolve on its own and hopefully stop the seizure. So now from Epilepsy Foundation, you need to have a plan for yourself, family, or for a peer. According to them, you and your family play a central role in your seizure management. Your success relies on being prepared to tackle whatever comes your way. This helps to organize your seizure activity information and helps anybody who's giving you anything, if you were to have a seizure, helps them to understand what to do and where to take you if they need it. This also helps by being prepared. The fear of having a seizure will not prevent you from having a normal life. To conclude, taking care of yourself or others in a seizure crisis requires an action plan so that you take proper care of the patient. And you need to know if you were going to give somebody rescue medication, you need to know what to do. So with the steps that the CDC gave, that can help. And then remember to stay calm and worry about the patient and follow these steps, and everything will be fine.